So Dan, I'm going to pass to you on the industry survey.
Yeah, thanks, Jason. That's kind of pretty darn scary about the scope of the audits. If they're going to be looking at our past acts, we really can't take any steps to remediate that, to fix it, can we? It's just we're exposed. Let's talk a bit about why we're making this presentation today, and that's trying to be responsive to what's actually out there in the market. NueMD in 2014 performed a survey of several hundred covered entities asking about how sensitive were the respondents to HIPAA, how much do they know about HIPAA, how far along towards HIPAA compliance had they been. And back in 2014, it was kind of hit or miss. I'll say that most of NueMD's polling data came from a smaller practice area, not the big hospital systems, but more the smaller practices and ambulatory surgery centers and other healthcare facilities. And back in 2014, it was kind of surprising that a good portion, more than a majority, had not taken some basic HIPAA compliance steps. Just fast forward a couple of years, and NueMD went ahead and did a second follow-up survey. This one, again, is pretty much skewed towards physician and other medical practices and pretty much small providers, 1 to 10 providers. Looked about 900 respondents, a pretty good polling size. And 60% of those polled in this year were found not to be aware of the pending audits. And as Jason said, that's something that is going to hit not only big hospital systems and not only business associates, but physician practitioners. And I suppose if you're a member of the audit, what's the first thing you do? You got to show them your privacy and security plan. If we go to the next slide, we'll see that 30% of the respondents have not even created a plan. So assuming you got audited tomorrow, the first thing that you would have to do is send off a copy of your compliance plan. Well, these 30 folks wouldn't be able to comply with that simple request. Next slide, we'll see that an important part of each compliance plan under HIPAA is to appoint a privacy and security officer. If you don't have a privacy and security officer appointed, your compliance plan is deficient and you could be subject to some penalties. So we see that more than half have not even done that. Even though it looks like 70% have created plans, maybe more than half aren't being compliant because they haven't taken this initial basic step. And on the next slide, we'll see that a full 58%, more than a majority, actually do provide training, but that still leaves a large amount of folks who do need to go ahead and train their workforce on HIPAA requirements. Failure to provide that type of annual training means that your compliance plan is deficient and you're subject to some types of penalties.